Welcome back to Singapore Tonight. Thank you for staying with us. Let's circle back now to one of our top stories tonight, fighting diabetes in a concerted manner. Now, for more on that, we're joined in the studio by Dr. DrNishtar, co-chair of the World Health Organization's Independent High-Level Commission on Non-Communicable Diseases, and Senior Minister of State for Health, Dr. Amy Khor.
Yeah, Dr. Khor, I'll come to you first, if I may. Singapore has launched a war on diabetes with a host of initiatives to tackle the management of it. Can you tell us a bit more about what you hope to achieve with this war on diabetes?
Well, first of all, currently Singapore has about close to 500,000 people living with diabetes. There is almost 1 in 9, which is higher than the global prevalence. And we estimate that this number will increase to about 1 million by 2050 if nothing is done about it. And that's why we have declared a war on diabetes. What we hope to do through this really is to reduce the prevalence rate of diabetes, or at least minimally to slow down this rate of increase, as well as, of course, to decrease the number of diabetes-related hospital admissions and complications. Our population is aging, so the prevalence rate may still increase, but we hope that we will be able to slow down this trend and that it will not be as high as if we had not done anything about it.
Yeah, and have we seen any progress in that so far? Are we able to tell that we're moving things in the right direction?
Yes. So this will be a multi-year effort. And of course, I think the benefits of doing this is going to take quite a while to show, because, you know, health cannot just change overnight. But indeed, we are seeing some encouraging signs through this war on diabetes. For instance, Singaporeans now, I think, are more health conscious, you know, eating more healthily, being more physically active. And we have seen this, for instance, through the fact that in 2016, 26 million healthier meals were sold, but in 2017, it's almost doubled to 50 million. And the latest National Nutrition Survey has shown also that Singaporeans are having a better quality in their diet, you know, more vegetables, fruits, whole grains, as well as the fact that they have reduced the number of calories between 2010 till 2017 from 2,600 to 247. Also, there's some good signs that some of these are taking effect, but I think it'll take a while before we can see concrete results.
It takes time for people's habits to change. The numbers in Singapore are a big concern, but globally it is also a concern. Dr. Nishtar, let's bring you in on the conversation here. Globally, we're seeing it as an epidemic. Are we doing enough to address this?
Well, actually, diabetes is one of the biggest epidemics of the 21st century. We're looking at almost 500 million individuals across the world suffering from diabetes. And we have to appreciate that it's the #1 leading cause of blindness, of renal failure, of lost toes and amputations, of the leading cause of strokes and heart disease. And what's worrying is that the trend is escalating very rapidly. So in 1980, it was estimated that there were 108 million diabetics around the world, but this rapidly escalated to almost 420 plus by 2014. And if you look at the entire bundle of non-communicable diseases, you know, which includes not just diabetes, but also heart disease, cancer, and chronic lung conditions, and if you look at global trends, the trends for some of them are declining. You know, the mortality trends, the trends in terms of deaths observed, certainly for heart diseases. But paradoxically, for diabetes, things are on the rise. So in terms of your question, are we doing enough? No, we certainly are not. And the world really needs to step up its efforts to address this biggest epidemic of the 21st century.
Yeah, and Dr. Khor, these concerns are something that the government has sort of identified as something that needs to be addressed. What are some of the challenges, though, in addressing these concerns?
Well, for us in Singapore, I think the 2 key challenges are really about late diagnosis of diabetes, because 1 in 3 Singaporeans who are living with diabetes do not know that he or she has actually got diabetes. And by the time this is diagnosed, complications could have already developed, and that means that it's harder to treat the condition. The other one is really about poor control of diabetes. Again, 1 in 3 who have diabetes have poor control of diabetes. And it could be for a variety of reasons. For instance, very often people may perceive diabetes, which is a lifelong medical condition, as something that is inevitable, part of aging, so there is no active intervention. Or it could be that the individual is not empowered sufficiently to initiate and sustain treatment adherence and lifestyle modification. So what we have done really is to adopt a multi-pronged whole-of-society approach premised on individual as well as stakeholder responsibility. So to get the individual to be responsible for his or her health, eat healthily, adopt healthy lifestyle habits, as well as get stakeholders to come together, for instance, to provide F&B outlets, for instance, to provide healthier options to consumers.
Dr. Nishtar, is this type of approach something that can be applied globally, sort of getting everybody to be more of a stakeholder in how they live their lives, the choices that they make? Is that something that can happen everywhere?
Well, the principles of addressing the disease, from the prevention point of view or from the treatment point of view is the same in all settings of the world. But Singapore is, of course, leaps and bounds ahead of most developing countries. The minister's point is very valid, but she is actually responsible for a health system where the infrastructure to deal with this problem is in place. So she has to tackle a whole other set of issues compared to what is relevant in the developing world, where the infrastructure is not just there. So between 2000 and 2015, when the Millennium Development Goals pledge was in effect, the world was very focused on infectious disease, addressing infectious diseases and maternal and child health. And now I'm not saying it's a question of either or my disease is better than yours, but we were just not honing in on the world's leading killers. Non-communicable diseases, of which diabetes is one aspect, are clearly the biggest global killers, and there's certainly no doubting that. But we never raised it on the agendas of, on the development and health agendas of the developing countries, and therefore the appropriate policy responses, the health system's infrastructure, and the multi-stakeholder-based solutions which you were referring to initially and which the minister very appropriately talked about have never gotten up and running. So we are really starting from a long way back when it comes to addressing diseases like diabetes and heart diseases in the developing countries. And it's going to take quite a while for us to include them into primary health care plans, make sure that they're part of universal health coverage initiatives as it gets institutionalized in countries. But we must start now because we're losing time as we speak.
The institution certainly could benefit from being a lot stronger with this. When it comes to the individual, though, individuals looking after themselves, I want to read you this quote from Deputy Prime Minister Tharman. He said, "We have to tackle the basic problem in human psychology." Dr. Kaur, I'll come to you to sort of interpret that. And how do you see Singapore addressing that? Because it almost comes down to you can't be telling people what they can and can't eat.
So I think we need to continue with our efforts, sustain our efforts to help individuals make healthy lifestyle choices easy and convenient. So access to healthy food, for instance, healthier dining options, easier access, physical activity more convenient. And to do this, we need a multi-agency, multi-pronged approach. And that's why we have set up this Healthy SG interagency task force to look at how to make healthy living a norm, make it pervasive, make it easy for people, bring it right to their doorsteps even, in order to help them change, shift in a mindset and change behavior. Because at the end of the day, that is the most critical. How to help individual change behavior to adopt healthy lifestyle habits. And that's important. For instance, we have about 430,000 people who are pre-diabetic. They have this pre-diabetes condition. And if they actually modify their lifestyle, they will be able to reverse that condition. And they don't have to progress to being diabetic.
And I suppose reinforcing the reality of connecting the dots between what you eat in your diet on a daily basis may not be affecting you now, but in the years to come, that could be playing a part.
And many of these risk factors which will, affect diabetes, impact the condition, actually is also similar risk factors for other chronic conditions. So by tackling diabetes, we also can help to tackle other chronic conditions.
A quick final question for you, Dr. Nishtar. When it comes to the burden on healthcare systems worldwide, where do we place diabetes and the effects that it has on a population?
Well, it's not just the treatment of diabetes per se in terms of the burden on health systems, it is also the treatment of its complications. So when you add them all up, the toll on health systems in terms of management of heart disease and management of stroke and the disabilities and blindness and chronic renal failure and amputation, it all adds up to something very significant. But just if I may respond to your earlier question as a follow-up to what the minister said, when you talk about lifestyle changes, it is partly individual responsibility, but it is also the environmental context which shapes our individual choices. So it is not, you can't just blame the choice of an unhealthy lifestyle. You cannot just place the onus of responsibility on the individual. We also have to make sure through government public policy decisions that the right enabling environment is there to facilitate individuals to make those right choices.
All right, thank you both very much for coming into the studios to share your perspectives on this very important topic. We've been speaking there to Dr. Sanya Nishtar, co-chair of the World Health Organization's Independent High-Level Commission on Non-Communicable Diseases and Singapore's Senior Minister of State for Health, Dr. Amy Khor.
Coming up, some business headlines with Sarah Al-Khaldi, including Hyflux is buying more time. The embattled water treatment firm has been granted an extension to its debt moratorium. Sarah will have those details when she comes back.